This is the 7th year that I went to Valladolid, Mexico, and it was an orthopedic mission team. And some of you may know Dr. Bob Nolan, who attended here, and he had gone for a few years before I did and had told me about it, and that's how I got interested in it and found out. And I want to thank you for thinking of me and praying for me and the team when we were gone. It was a wonderful mission trip. And our team consisted of 2 orthopedic surgeons, myself, I'm a nurse anesthetist, an anesthesiologist, another nurse anesthetist, an anesthesia student, nurses, a surgical tech, and a few general helpers. So people flew from, you can put the first picture. Okay. They flew from different states, and we all met at the Cancun airport, and there we are outside the airport. Dr. Henderson, on your left, is the team leader, and he's an orthopedic surgeon. He made all the arrangements and organized the trip. And there's some members of our team. You can see all the boxes of operating room supplies. So we waited till everybody got to the airport, and then we took a bus, next, about 2 hours to the city of Valladolid, which is inland on the Yucatan Peninsula. There's the bus, and the man there is Dr. Driesnick. He did the knee replacements, but he was not able to go this year, so we just had 2 surgeons instead of 3. So we took the bus Saturday, January 10th, to Valladolid. And next, that's the central square in the city. It's a city of about 70,000 people, and we arrived Saturday evening. Do the next one. That's the Mission Hospital, and that's been open for surgery since 2010. Someone donated 10 acres of property there for the hospital. It has 5 ORs, and 2 large churches in the United States raised funds to build the hospital. So we spent Sunday, the nurses and anesthesia team were setting up their supplies and organizing supplies, equipments, medications to get ready for surgery. And the large room when you enter was filled with people, and the orthopedic surgeons saw them. They interviewed them, got histories through translators, examined them, triaged, and determined who they would operate on during the week, and made an OR schedule up. That's another picture of the hospital. It's beautifully landscaped. There's 5 operating rooms. So Monday through Thursday we did surgery. Friday was a day of rest and relaxation, and Saturday we headed back to the airport to all go our own ways. There's another picture of the hospital. And this is, on your left is Dr. Binkley. He's a surgeon from the Atlanta area, and he did knee arthroscopies, and I worked with him. And the other man is Dennis. He's a nurse anesthetist. Next. There I am in the operating room. And supplies are a little disorganized and different brands and features, so it's not as easy as at home. You have to kind of gather and use what you have. Sometimes equipment or medications are in short supply. There we had just finished surgery, and that's our OR team. That's the recovery room. And another picture of the recovery room. And next, this is Adolfo and Martha, husband and wife, their 22-year-old son Abraham. They live in Mexico, and before each patient went for surgery, they would meet with the patient and the family or whoever was with them and explain the gospel to them, show them Bible verses, give them a Bible, and the opportunity to accept Christ. So each patient and their family was presented with the gospel. And next, this is Felipe. He's a Mayan man who pastors a small Mayan church in a Mayan village outside Valladolid. And the Mayan people don't necessarily understand or speak Spanish, so he was able to talk to them in their own Mayan language. This is the lunchroom. We had lunch here, and we would have morning devotions in this room in the hospital. And this is right outside the hospital. You just walk a little bit and This is where we ate our breakfasts and our dinners. And it was nice to fellowship together too. And there we are back in the beginning. So this past January, these two orthopedic surgeons had 118 patient consultations. We performed 19 surgical procedures. There were 27 injections for pain management, and 190 people accepted Christ. And it was an excellent trip, and God answered all the prayers. Everyone remained healthy, safe travels. We worked well as a team, and the surgeries went well. And if you can pray for the patients that they recover well and that they grow spiritually, get involved with the church where they learn more about Christ and grow in spiritually and in fellowship with other Christians. I was sad to hear when I arrived there that Dr. Henderson, our team leader, is not planning on doing this again. And it's the only orthopedic mission trip to this hospital because of some logistic difficulties. So you could also pray that God will raise up another orthopedic surgeon to head up and arrange and organize another mission trip, and that people would be willing to go. And if you've never gone on any type of mission trip, I would urge you to do it if you're able to, because you're not only helping and serving others, but it's a blessing to yourself as it was to me. So thank you.